Hello and welcome. Welcome to Reach Live. I'm Reena Sangar. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency. And we love data and we love talking about data, which is part of the topic that we have today too. Reach Live happens at the last Friday of every month. So I hope you are subscribed and you're linked to us. We are on YouTube and LinkedIn and all the other social media platforms that you'd expect. So do please follow. It's my pleasure today to have on as a guest, not only someone I respect a lot, but someone I truly can call a friend, Anna Kravets. Anna, thank you for being with us today on Reach Live. Please give an introduction to people who are watching.
Thank you, Reena. I'm Anna Kravets. I'm the president and co-founder of a company called AdirA. AdirA is a consumer health action platform, focused on driving that desired health action in the population and improving health for everyone.
We're going to get a lot more into that, the kind of drive and purpose of your company and what you're doing. But I want to start at the beginning, where we met. Well, not the beginning, but where we met. Anna, you were the chief digital officer of a pharma company when we met. And remember being incredibly impressed with your talk at one of the big conferences where you spoke a lot about the desire and the drive of the marketplace and what needs to happen. You were one of the earliest CDOs I saw speak in a way where you really understood the action that needs to happen in the industry to make change. So my question to you first is, how did you decide, how was it, firstly, to be part of a huge corporation as a chief digital officer? What were the challenge? What was the pros and what were some of the challenges before we then get into your new role?
Definitely. It's been an interesting journey. So I was a chief digital officer for health services and solutions, within Merck. It was a portfolio of companies where we, created and incubated new businesses, or, Merck invested in businesses and then grew them. Obviously, it's nice to have a, well-known and respected brand, behind you. That definitely opens a lot of doors and conversations. It's great to have resources of a large company, both financial resources as well as the depth of knowledge that the organization has. But as all the benefits come with some drawbacks. So being within a large organization that has a massive portfolio that is not digital, right? It's drugs and vaccines. That's always will be a priority. So as much as there is interest in digital, it always gets evaluated through the lens of what kind of benefit and risk it presents to the overall mandate of the company. And digital, like any other business, comes with certain risk, reputational risk, data risk. So you always have to you're always like a smaller kid on the block within the overall priorities. In addition to that, if you especially are trying to do something, direct to consumer, there is a lot of limitations of what you can and cannot do from, compliance standpoint, as well as kind of perception and reputation. And when you, go directly to a consumer with any offering, from a large organization that has product to sell to that consumer, they always will be a little bit, more skeptical. Are you doing something, for me, or you're just trying to kind of move your portfolio? And in addition to that is also, we're always, and I think, any digital company in the digital health space, needs to be and is, consumer centric. Everyone talks about, consumer centricity. And it's very, difficult to create and find something that is truly focused on the end user and patient, consumer centric. where, your company has only certain, things kind of to offer and certain domain of knowledge and certain reputation. So, with taking all of that into account and really, kind of catching that spark and that intent and mission of really transforming, healthcare and helping the consumer. I and my co-founder, Monica Chowdhury, who's also, ex-Merck executive, decided to, go and start the company outside, of the pharma space, so we can better integrate with the rest of the ecosystem, that we can be have fewer constraints to be like full cycle, full circle, patient centric.
I think it's just such a fantastic pivot, because you've been in a position where you've been pitched to a lot. You've understood various things that you wanted solved, and spoken to companies. You've seen them also evolve and change. So moving into the other side, what was it for you? What were going to be the principles or the essence that you were going to take forward, or have you taken forward with AdirA?
Definitely, there are kind of certain, principles and ideas that we, felt strong that we will carry into, our business, into our startup. Foundationally, as I said, being consumer centric, patient centric. And with that, we have kind of 3 pillars of everything we do, that they kind of, the moral and foundational principles we, building upon is trust, value, and fun. We wanted to make sure that, consumer trust us, that the information is trustworthy, the way we talk to them is trustworthy. We deliver them value, right? Value in terms of, services and information we provide, but we also value their time. There's so many solutions that just try to engage you, suck you in, keep you in, waste your cycles. We always, try to build experiences that, solve, zero in on your problem, solve it for you, target 3 to 5 minutes, give you what you need, and you off, on your journey. So that, time is money, super valuable. And then, fun. We wanted to make sure, even though we're talking about serious topics, oftentimes, we maintain that, kind of level of engagement and level of the conversation that, helps people, through those, difficult health decisions. And we are focused. What we also kind of looked at and discovered that 77% of people that search for health information online are women. So obviously it doesn't mean that, women are disproportionately sick compared to the rest of the population. What it tells us is that women are doing research, making those health decisions and implementing those health decisions, not just for themselves, but for the rest of the family. So we decided to, create a kind of a, woman as a focal point of our entry into the family, which is kind of hard to reach population. You cannot go directly to children. It's hard to reach, parents or in-laws, that oftentimes are aging, maybe not as digitally savvy, overwhelmed with healthcare system. We know that especially in US, it's, you need a PhD in our healthcare system to really understand and navigate it. So it oftentimes, and getting that, partner sponsor who are oftentimes, are resistant to go and take care of their health. So we felt that, helping the woman to with that decision support on specific, healthcare decision, giving her resources to implement that decision, and preparing her for productive conversations with healthcare system, whether it's, a provider or a counselor, whoever it is in healthcare system, is, will help her take care of the family. So she, at the end, actually finds time and cycles, mental, and physical to take care of herself as well.
Now we've at Ipsos too have tons of research which supports this, that the female individuals in a home tend to be mothers, are the chief wellness officers of that home. So they take care, and they're the ones that kind of more proactive. They keep the over-the-counter draw supplements, up to date. They sort the vaccinations. They are thinking about preventative health more so. Not to say completely, but more so. And there's data to support that. Let's talk about engagement, right? One thing is tapping into the harder to reach groups, which I know is really important to you, and bringing people along the journey and giving them the trust, the value, and the fun. But we also know from data that we lose people. Stickiness of tech is a problem. Engagement is a problem. So talk to me a little bit about that. What are you doing on that?
Right. It's interesting that you mention it. And I see this trend, a lot of companies like, do you have an engaged and sticky audience? They kind of think that there is some magic formula that, put honey all over your digital solution. And once people will come in, they'll stick there and be available and accessible. And they will be in the right mindset to receive the kind of outreach that, you trying to reach them out at the same time. That is not true. So what we are realizing is we're creating kind of context and micro moments, where we kind of capture those people in the area of need that they have, right? So I think those activation moments, could be life events. It could be, lifestyle events. So one of the projects that we have, and I'll talk a bit more about that, as well, is health and travel platform that we have. And we feel that we're there addressing a specific problem, but if you think about it, travel is that lifestyle moment in which, person, yes, there is elements that they need to do, to prepare for, healthy travel and protect themselves and the family. But it's also, opens up an opportunity to maybe activate them about some other things, since they already kind of in that mindset of, thinking of something. So it's, and kind of going, a bit on kind of related topic is it's very important, what we have learned that, and Reena, you asked, like, I used to be pitched that, and now we pitched, solution. What always kind of, triggered me when, just because, digital health, that term, like digital, everyone is excited about digital. Everyone thinks it's about technology, right? So, when people come and pitch me about, wonderful tech that they have, it's interesting. But what, especially in the last few years that we kind of ran our own company, we came to realize that technology is a very small portion of your solution and success of your solution. I would, be, I guess, provocative and say it's, maybe 10 to 15% of what is important. But what is difficult, to do, and not to say that tech is easy, but it's, it's easier, it's tangible. What's difficult to do is find and really understand the right problem that you're trying to solve. And put the data behind the problem, have the evidence that this is actually a problem. And then understanding, so if this is the problem, not even what is the solution. So if something that is happening or not happening, usually on the consumer side, what is that, health action that needs to occur, right? So understanding the problem, understanding what it is that, the health action that you need to have, and then outlining, behind it, what are the barriers and what needs to happen to really drive that health action. There could be gap in understanding. There could be gap in, resources that you have. There could be social determinants of health, that get in the way of person, taking that health action, kind of peeling that onion and then constructing solution that really optimizes and drives that health action. And if you have that as a foundation of what you're building, then it becomes very easy to know, what to build, how to measure it, and how to optimize. Everything we build, we optimize to that health action. We know, what comes into the funnel, where the drop-offs happen, and we religiously monitor why they happen, and we remove those little barriers, adding services, changing the conversation, changing the data, changing the messaging, to drive that health action. Once you have that, you have your data, you driving the action, guess what? You have a digital solution, right? You have a digital health solution that is delivering results, delivering outcome. And to, not only to stand it up and run it, as I said, tech is only 10 to 15%. The rest of your work and the hard work and not very glamorous work is going to be business, content, and operations. From the business standpoint, there will be a lot of work, that you will be spending on consumer acquisition. Back to the question, Reena, that you brought up earlier. How you activate, how do you attract people, how do you bring them in? And there always will be the external factors, and you need to be on your toes, knowing how you're going to be driving the solution, because the fact that you build it doesn't mean that they will come. You'll need to work on them in. Go to market, right? How are you going to be making your solution sustainable, because the fact that you took some money from VC, built something interesting, if you cannot have a sustainable a revenue model, that's going to fall on its face. Content, you need to have good content from the beginning, and you need to keep it fresh, and you need to add more, and you need to stay relevant with your content. And then operations. So when you add up all of those business, content, operation tasks, that's where majority of your work will be.
I mean, if we could just package this up and use it as onboarding for all digital health companies that are wanting to come in, it's just such fantastic advice, and it's gracious of you to share it, to be honest, because time and time again, I do have the wonderful privilege of seeing a lot of new concepts and testing a lot of these concepts in companies. And it's unfortunate, really, how many times I have to really work hard with them to understand what is the health action. What are you looking to solve? And this obsession with capturing as much data as possible, because the data science will figure it out later, is a really bad idea. It's a really bad idea. But,
It's always easy, the easiest thing is to capture data. Right? But you have mountains of unstructured data, you don't know what to do with it. Like, it's interesting trivia. The next, harder thing is to ask good questions of your data and knowing what you're going to be asking. And then once you get some information, some insight, what you're going to do with it.
Right?
And those are. Yeah, and it's it's easier to build tech, to build some capabilities. We're going to build technology platform, and then we have this great thing, and then they're going shopping around for use cases. How about you start with use cases and maybe utilize the technologies that already abundant in the ecosystem that are looking for use cases, that brings your time to market, cut it dramatically. The amount of funding that you will need to start and get running, cuts down dramatically. And frankly, there is already investment made into this digital health space. Let's all, work in this ecosystem as partners and support, and let, everyone and everything grow together. It's a team sport.
And I think the industry is learning that. We're seeing news of mergers and collaborations more and more. And it's because I think we're understanding that partnership is the key here, not duplication, not trying to, hurdle over one over the other. The other big news story this week that's been talked about a lot in the industry is the change at Google. Google Health, the folks that understand how to manage data, who continue working on that. They're not leaving healthcare. But it was a lot of conjecture this week around, we'll see how hard it is. We thought tech was going to really come in and help, and they absolutely are doing things. But I know you've got an interesting take on this as well, but I just feel it kind of feeds to the point that you're making. Let's all be far more considered about what we're trying to do and really be clearer about what we're trying to solve for. So yeah, what's your view on it?
Yeah, it's interesting. And I think, technology and, venture, capital community in general has, its own kind of lens through which they look, at the investments. They're looking at, hockey stick growth, right? What makes you unique? What's your IP, right? So they take this, all of it with the exit mentality. I'm putting money. What are the multiples that I'm going to get at the exit? And I'm not sure healthcare is necessarily, falls into this model all that well. My kind of experience and my view of it is in health IT, it's not as much about IP where your value is. It's about your know-how. And that know-how, I think, is just as valuable as IP. And it's not, as easily reproducible as people think. Ideas are cheap. Execution is where most of the things, fail. Execution, perseverance, continuous learning. And this is where those, non-glamorous, business content and operation comes in. And the longer you stay at it, the more you learn, the more that know how you develop and more valuable your company becomes. Because I feel that, there, in my opinion, in health IT, there's no simple formula. You have a recipe and you just, keep baking those, cakes or cookies or whatever, following that recipe. It's much more organic. It's much more, constantly under influence of a lot of complex, ecosystems, external factors. To me, I equate it to kind of like making wine. So first you need to plant your vines. They need to grow. They need to produce fruit. You need to take care of them. You have some, kind of science on how you do that. Science, how do you, make wine? But then you also need to age it, and then you need to serve it. So I think it's a much more, complex, organic, and nuanced process than just, some magical machine is going to crunch through things, with the secret IP and solve all the problems.
Yeah, this whole thing around time, is a marathon. It takes time to do, things that are going to be really great and worthwhile and make a difference. And it disheartens me a lot. I was having a conversation with a different chief digital officer actually quite recently, who's been in the role for some time, and they've been tasked with showing ROI within 1 year, and that's incredibly tough. That's incredibly tough. And I understand from a business acumen, they're like, well, we're throwing all this money into digital, we want to see something back. But I think we have to walk away. We have to challenge business with this 1 year mentality. Because if we really want to create breakthroughs that solve true problems, and that's where we're at, right? We want to solve true problems, not just reiterate what's already out there, then we have to have a marathon mentality. Tell us about something you're working on or what you have worked on. You talked about health and travel, and I know that's something that's kind of a big part for what AdirA are doing. So give an example of a piece of work you're doing.
Yeah, I'll share, a couple examples of what we do. And it's not to say that you will not, have some incremental like learnings and results and insights, but, if there's a hard like ROI, making, multiple returns, that's, I think, where things break down. So as I mentioned, we always start, with the problem. So one of the platforms that we have built and launched earlier this year is called Health and Travel. And the problem we started with is that, we started it pre-COVID, had nothing to do with COVID, that only 1 in 5 travelers outside of US going abroad have been seeking and receiving professional pre-travel health consultation, and then taking the right precautions or knowing how to protect themselves, whether it's getting the right vaccinations or the right health behaviors or the right, prophylactic treatments. So 1 in 5. So, what is it, 80% of travelers would be just, going around the world on their, merry way, adventures, and not really taking precautions. And we said that if you work for a big corporation, oftentimes you would have internally, the travel health consult, they'll take care of you. But there are a lot of, leisure travelers, people visiting, friends and relatives who go out unprotected. And I think, what COVID really zeroed in on, it's a big world, and the disease travels, right? So it's good for everyone to be protected. We said we will, democratize travel health. We'll make it available for, as many people. And our goal is to reach all of the travelers, traveling outside of US. Going back to what I said, we will leverage, some of the existing, platforms and the capabilities, that exist in the market, everything from, we didn't stand up our own cloud. We use the cloud where we're hosting, the site where our, conversational triage is using a conversational AI platform. Our data confirmation is using, existing, capabilities. We didn't stand up our own marketing, platform where we're, buying services from marketing. And we're driving traffic into the platform, both through digital channels, kind of reaching out to confirmed travelers, as well as through a network of partnerships that we, are building with companies that sell, travel-related services, whether it's booking services or, travel insurance, travel health insurance. We, do the consultation. Starting with, more of a virtual assistant, a chatbot, but then triaging people into a clinic where they can, get, full kind of complete the consultation, get prescription for what they need. We're also in the process of standing up a telemedicine that will be launching this fall. You believe it, we are, watching our funnel, everything from consumer acquisition to, to the profiling that audience, to how they flow to that health action of getting consultation and getting, their vaccinations done or, scripts filled religiously. And we constantly tweaking. And with that, we're able, all of our solutions, and this is just one example of them, are delivering 2.5 to 4.5 times industry average on the conversion to the health action.
Is this product available in market now?
It's the system is live now. It's healthandtravel.com. So next time
nice and simple.
Go get advice. We also, are working with New York State Department of Health, and they're working with more of a populations and the kind of lower socio-economic situation that are looking to understand and engage with the services provided to them. That's another big area. And we've been told that this is the population very hard to engage, very hard to get results on. And again, we're triple the industry average even with that population.
I've absolutely no doubt. I mean, I just think you're coming with the right, just the right thought process on things. I'm going to be hopefully traveling soon to HLTH Health. I'm going to give Health a shout out for end of October. For those who are listening on demand or here now, do register. It's going to be a fantastic event. Reach will be there. I can confirm that Reach Thought Leadership will be attending Health in October in Boston. And Anna, I hope you'll be there, and I hope we'll get to meet in person finally again after so long. Thank you so much for being with us, for sharing your knowledge of this space in this area. Let's fold up with a quick 3 things. You said so much interesting insight, but give me 3 things that you want the group here that have listened to take away from them.
Yep. Number 1, fall in love with the problem, not a solution. As Einstein said, if I had an hour to solve the problem, I would spend 55 minutes thinking about the problem. So, take that advice. Number 2, really focus on, the business of your solution, how you're going to be operationalizing it. Don't shortchange that. And number 3, always know that what's the action, what's the outcome you're building toward. That will crystallize everything else and will make it, easy. And the last thing, I guess, the bonus one, don't build where you don't have to build.
Yes. Thank you so much, Anna. Thank you for being with us. Thank you to everyone that joined. For those watching on demand, this talk was available on YouTube, so I might be seeing you on YouTube. Hello. Please do subscribe. Please do follow Reach, and we look forward to seeing you next month with another wonderful speaker with a lot more insight. But for now, thank you so much for your time. Thank you, Anna, and speak to you all soon. Have a wonderful weekend. And for those in Europe or in London and UK, enjoy your bank holiday weekend. It's a long weekend this week. Thank you.
Thank you, Reena. Thank you, everyone.